Right. Well, welcome. Thank you so much for taking time on your weeknight. I know that it is no small ask when everyone has had a long day, but I appreciate you tuning in. We're going to talk a little bit more about peptides. 20, as I said, I kind of broke them into the four common categories we see them in. I expect it to take about an hour. I'm going to try to talk for 35 to 40 minutes. I'm kind of known for going over, but I'm going to try and then answer all your questions at the end. But if you've been anywhere on social media, you've definitely heard the word peptides. And I find a lot of times people kind of have heard them, but they don't really know what they are. So that's what we're going to go into more tonight. This is a little bit more about me. My name is Holly. I'm a functional wellness provider. My business is Healthy by Holly. I'm a concierge practice for adults primarily 30 and up. I work with both women and men. I'm located in the DC metro area, but I work virtually with clients across the country. I'm a certified nutritionist. I have certifications in hormones and hormone therapy, gut health, peptides, functional wellness, lab work. I'm also a mom of five. And I struggle with an autoimmune disease. So peptides for me were something that I tried personally before I ever introduced them with clients, just looking to help myself. The big difference, I think, in what I do versus a lot of other people out there is that I combine holistic care with clinical oversight and diet and lifestyle. So we put everything together. I find that a lot of people maybe they do holistic or they're traditional practice or they're coaches for nutrition, but everything isn't put together, which is where the real magic comes from. As I said, I specialize in hormones, metabolism, peptides, GLP support, so hormone therapy, and then genetic nutrition as well. Kind of what we're going over tonight. We're going over the peptide categories. We're going to go over what they do, how you stack them, who they're for, how you might want to think about them in terms of a plan. This is not medical advice. I'm not going to give specific prescriptions, and this is not an MLM. I'm not sending you to some sketchy site to order them online. It's mostly just about educating people and helping people understand peptides better and how they might want to fit them into their own life and health.
Cool.
So, what is a peptide? If you've heard of a peptide, you might want to know what it is, or you might not even be sure what it is. It's just a short chain of amino acids. It's about 20 to 50 long, and what it does is give a signal. It's not a hormone, it's not a drug. It doesn't work like a prescription. It's almost just like a whisper in the background. It is giving that targeted message to our receptors in our body that it used to have. We used to give them better when we were younger. And now maybe as we're aging, the body kind of forgets what it's supposed to do, or it's slower at what it's supposed to do. Or when we talk about things like GLPs, some people genetically make less of it. So we know now with peptides that not only are these amino chains more present in the body when we're younger, they decrease as we age, they don't work as well as we age, but some people just have less of them. Key functions, we use them for restoration, we use them for regeneration, we use them for neuromodulation, so things with the brain and with cognitive function. We use them for immune balance. There's a lot of talk about autoimmune issues right now, autoimmunity problems there, or trouble fighting off infections. We use them for metabolism. So whether it's optimizing your metabolism or working with blood sugar or working with fat loss and longevity. So telomere function, sleep, they call it biological youth. So our sort of recovery that we used to just do better when we were younger. 5 reasons why peptides work or why I think that they're different than anything else. They're bioidentical. So we hear that a lot with hormone therapy. Peptides are also bioidentical. So they're very similar, even though they are not exactly they're not from your body. Your body still interprets them the same. They're very similar, which means that your body already recognizes them. It's a feedback loop. It helps it turn on and off based on what your body needs. So, like a prescription, we almost think of a prescription as turning on the sprinklers and everything gets wet, not just the fire. So when we're talking about a peptide, we're talking about something much more targeted, much more localized. They're very intelligent in that way and that they work just for what the body needs and they don't tend to overdo it the way other things might do. They're stackable, so we use them synergistically. We use them together. So we might use something that calms inflammation in one way. We might use it together in a stack like Wolverine or Glow, where we are looking for the targeted approach of them working together. I'm going kind of quick. So if I'm going too quick and you think of something, I'll try to get to the chat at the end. Um, so if you have questions, you can just put it at the end.
Okay.
Are peptides safe? So that's another question that we hear, and kind of something that has made me want to make this webinar is not just, hey, I see peptides every day in my practice and seeing the amazing things that they're doing, but I'm also seeing a lot of use that is not right. So a lot of people using things that are either research grade, they're using them inappropriately, they're using the doses too high, they're not taking breaks. So that's where peptides become unsafe. When they're used responsibly and they're sourced from a reputable place, they are among the safest targeted therapies we have. They are one of the best ways to heal the body. They're not working like a synthetic hormone. They're not working like a pharmaceutical. They are much more natural in the way that they are signaling the body and helping your body do what it's supposed to do, what it's forgot to do, rather than working against it. When you stop taking them, they have a very short half-life. They're in and out very quickly versus something that stays in the body for a long time. Peptides are not new. Peptides have been around for a long time. Actually, insulin is the same, so it's a very similar class of as that, and they've been used in hospitals. There are FDA-approved peptides for HIV, for burns, for brain trauma, diabetes, fat loss. I've had orthopedic surgeons send clients to me to get the healing that they need. So we're seeing them used a lot. It's not just a fad that we're seeing on social media. It's something that is used in hospital setting. It is something used by doctors. I have clients that are doctors using the peptides. And we're also very good at dosing precisely. I'm not going to go over doses tonight for each individual because that's individualized and something that a doctor sets up for you. But we are able to use peptides at a smaller dose, even micro dosing with the GLPs. And that allows it to create just the change we need without overdoing it, which is something we see a lot in pharmaceuticals. We kind of are just shutting off everything. And with this, it's a much more targeted, kind of a quiet whisper, like I said, in the background. Common routes of peptides, I get asked this a lot because we're seeing a lot of oral peptides out there. I'll be honest with you, there's not a lot of bioavailability in the peptides when they're taken orally. So if you think of something like salt water, we have saline that we can do in our eyes and in our nose. But if we drink salt water, we're out in the ocean, or if we were to drink really salty water, it will make us nauseous. It might make us sick. If we go get an IV, that is also considered a saline solution. The route is what is determining how well it works. And the same is true with peptides. We have oral peptides. I've listed them out there. I won't go through all of them. We do have both the tirzepatide and semaglutide oral forms now. For things like gut repair, the orals tend to work well. They go in through the gut, so that's why we see pretty good uptake with the GLPs or things like BPC if it's being used for gut health. Glutathione also sublingually works really well. We also have GHK copper serum. That's the only serum that we have. People use it for hair and skin when they don't want to do the injectable form. I'm sorry, I drank my water a little fast. Because GHK copper, when it's taken by itself, some people find that it stings a little, so some people will do the topical form of it. By and large, injectable peptides are the gold standard. You're bypassing the liver, you're getting a very quick uptake, your body absorbs it much better, you absorb much more of it. So bang for your buck, much higher with the injectables. It's a tiny little needle. People ask that to me too. They're expecting a flu shot. It's an insulin syringe. So tiny little syringe, tiny little needle. You do need to keep them refrigerated because peptides are fragile. They tend to break down really easy. We want to keep them refrigerated. We want to be gentle with them. And that's also another reason why oral peptides don't work really well because the acid in your stomach breaks them down. These are the four categories again that we're going to go over tonight: repair and regeneration, body comp and performance, brain, mood, and sleep, and longevity and hormones. I kind of grouped longevity and hormones there together. It's not advancing. There we go. Repair and regeneration. When the body has forgotten how to heal. The first two here are going to be BPC 157. It's kind of called sometimes the cellular medic. BPC 157 works on inflammation. It really helps with gut healing, bloating, post-antibiotic use, leaky gut. Also, injury recovery. There have been some amazing studies showing it in healing things like knees and shoulders. People will use it that both when they have an acute injury, like they're repairing from surgery, or maybe they have like a sprained ankle, but also in chronic injuries, things like knees. I've seen clients have great results with that, meniscus tears, things like that, where they needed that healing. Nerve regeneration as well with BPC 157. TB 500 is for tissue repair more, soft tissues, tendons, also the gut lining. You're going to find the repair peptides, because they all work on collagen synthesis, are going to have overlap. So we talk about what do they do, there's still going to be overlap. And you'll find that with a lot of the peptides too, but especially these ones that work on repair, they're repairing different pathways, but those pathways are going to result in repair in similar areas. So gut health is one of those. We also talk about these in terms of inflammation. TB 500 is also good for smoothing tissue. So women will sometimes talk about how their face looks firmer, or if they have scar revision, it's used in combination with GHK copper for that reason quite a lot. BPC and 157 and TB 500 are also commonly called the Wolverine stack. So if you hear someone talking about the Wolverine stack, that's the blend of these two together. They can be given together. There's always the question of should you be giving them separately? Our pharmacies test everything and make sure that it is still has the same efficacy after 30 days, even once they're combined. So we know from that testing that it works just fine together. There's some question about dosing TB 500 twice a week. Right now, there's not enough to suggest separating them. So I still think that it's just fine. And that's the collective understanding right now. Peptides they're not new, but constantly people are coming out with new studies. A lot of what you see is what I would like to say hypothetical. So we are not in a lab. We are humans. Our bodies are very intelligent. So just because we take two things at the same time and one's acidic and one's alkaline and they're in different locations doesn't mean they cancel themselves out. So that's something we'll see a lot of like hypothesizing out there, but the Wolverine stack still works great together. And then you have the other two here, GHK copper. GHK copper, sometimes people refer to that as the pretty peptide. So if you ever see anyone say the pretty peptide, that's what they're talking about. That's because it works on collagen, again, hair, skin, and nails. Excuse me. We have many types of collagen in the body. GHK copper is primarily targeting that collagen that's in hair, skin, and nails. We also see it with wound and scar healing. So not only do women tend to notice that they have women and men, I say women, so please don't be offended if you're a woman and you're thinking I'm talking about that, but GHK copper is used a lot in the settings of your med spas, for wrinkles and for people who have scars, burn scars, or scars on their face. I guess I'll go over my results with it when I go over the blend because I took a blend, but GHK copper right there. GHK copper sometimes can sting, so that's the only one I'm going to make a note about. If you take it purely by itself, some people find that it stings just a little. Not like a hornet, but it can sting. That's going to be the only one you really see that with. And there are some studies about it also with neurologic repair and KPV. KPV, another inflammation. It's the fourth here in these primary repair signals. Really a gold standard for gut health and anyone who's dealing with autoimmune. So if you have any kind of autoimmune condition, there's a lot of talk about MCATs right now, mast cell activation. When we talk about tirzepatide, things like that, microdosing, but we also talk about KPV for those autoimmune conditions. There's some studies with post-COVID and long COVID with KPV that have been really promising too, and people with psoriasis and rheumatoid arthritis. Again, that same autoimmune thread. I deal with people with autoimmune all the time. That's actually autoimmunity and autoimmune conditions is what got me started in nutrition years and years and years ago. And it would have been really great to have this around because I have watched firsthand people really, really, really struggle with autoimmune. And then women, as they enter perimenopause, tend to struggle with mast cell activation quite a lot. So this KPV can be really helpful for that. And personally, I look at the stacks. So these two stacks are, I would say, arguably behind BPC 157, but maybe taking over it as the most common thing you hear behind GLPs. Glow and Clo. Glow comes from the Wolverine plus GHK copper. So the understanding is they called it glow just because you had a glow along with your repair. And that was where that name came from. It's not an acronym. Some people try to put it together as an acronym, but it's not. That's what we use it for there for inflammation. It's not just for appearance, though. You're still going to get the people see drops in joint pain, they see drops in inflammation, swelling in the face, all over inflammation reduction, and then the hair, skin, and nails. Clo, very similar. Clo adds KPV. So that's why you see K at the front. If someone is having a lot of trouble with autoimmune, or we think it's a primary inflammatory driver of their issues versus just an aging, we tend to lean towards KPV. I actually started out a bigger fan of Glow because I thought less is probably better. And then I've actually gotten much more of a fan of Clo because I've seen how well women do with the addition of KPV. The KPV also tends to modulate down the GHK stinging. So I find people get more of a reaction with Glow than they do with Clo, especially women. Probably because you're getting that mast cell activation that women are known for. We get a lot of histamine issues, and when you have the KPV, it shuts that down. So people tend to do better on Clo than they do on Glow. Glow usually has a little bit higher percentage of GHK copper, though. So if your primary concern is hair, skin, and nails, and you don't really have the autoimmune or you don't really have histamine issues, you probably would lean towards the Glow. Personally, this was the first step that I did. I didn't take before and after pictures because I wasn't expecting it to change some of the things that I noticed. I was taking it for nerve. I have a really significant permanent nerve injury, and so that's what led me to go on down the peptide route. I was trying to mitigate the amount of ultrasound guided nerve blocks and nerve medications that I need to take, and it's actually significantly decreased that. I also find that I used to get nerve blocks and be basically on a couch for 2 days, and now I can get them and the next day I'm fine. So for me, in terms of inflammation and recovery from the really painful type things, it's been just an absolute game changer. But I also noticed that I had ganglion cysts and Morton's neuromas in my feet, which made it very painful for me to walk. And they went away. I wasn't expecting it. The one on the top of my foot you could see, and then it was gone. So that was a really big thing that I noticed. And then hair, skin, and nails. I have a lot of women that will take Glow or Clo when they're on GLPs because they have the consideration of hair drop. Or if they're in perimenopause and they have hair issues, they'll go on this. They very, very frequently tell me how much better their hair is coming in, it's growing. Men as well have that. If you don't want to take something that is modulating your testosterone, gentlemen, you might want to consider Glow or Clo because I, across the board, have heard people tell me that their hair is growing in thicker and growing faster. And the other two we have are LL37. That's an immune for chronic infections. So Lyme disease, Epstein-Barr, mold, post-viral, SIBO, seen help with SIBO with that. It's not as common. So that one and thiomosin alpha are two that you probably want to be using only when you're in conjunction with a functional provider. We do use them. They're very helpful. There's a lot of talk right now about mast cell activation, long COVID, people who are having a lot of trouble with their immune systems. It actually people really couldn't win because we see it both in people who got the vaccine and people who got COVID. So there really wasn't a way, I don't want to say a way around, but a lot of times there's that, oh, well, this is because of the vaccine. Well, yeah, but we see it in people that got COVID too, or vice versa. So we are seeing a huge uptick in that. Some people hypothesize it's because we were all separate from each other for so long. We downregulated our own immune systems. Regardless of the reason, we are seeing a lot of people dealing with long infections in ways they didn't. They're getting sick more frequently, or they're having these chronic viral infections, whereas they used to not. And these two can be very, very helpful in that, but you just want to make sure that you're working with someone. These are not two that I would take without talking with someone. Not that you should take any, but like the glow stack, okay, is not going to be as big of a consideration what's going on in the background as these two would be. So that's the only word of caution. But if you're someone that is struggling with that, there's definitely something that I would look into and find a provider who is familiar with them because they can really help. Next, we have body comp and performance. These are our growth hormones, fat metabolism, and recovery. Okay, so I do want to clarify because whenever I say growth hormone, people go right to steroids. These are not supplying your body with growth hormones. They do not work in the way that a steroid does. They are working with your pituitary gland and they are asking it to make more growth hormone or release more growth hormone. So it's not going to be something like the steroids, like what we think of when we think of people that take steroids or take synthetic growth hormone. It's very natural, just working in your release. We produce less of it, we release less of it as we age. CJC 1295, this one helps you with your GH pulses. It's known for fat loss, recovery, deep sleep, collagen production, all the things that come along with growth hormone. Then we have ipamorelin. It's a GH signal, so it's helping you create more. It also helps with lean mass. So women, particularly, these growth hormones can be very helpful. We produce a lot less of it. I've worked with a lot of women through perimenopause, and I see how difficult it is to maintain your muscle. And I say women, I know that this is a struggle. I've worked with many men too. It's just that in looking at who was coming tonight, it was mostly women. But when we age, we produce less testosterone. We produce less growth hormone than that exists for men and for women. Testosterone can be great, but it carries a pretty robust side effect profile. So I've worked with a lot of people on testosterone. I've seen a lot of people do really well. I've also seen a lot of people lose their hair on their head, gain it in other places. I've seen a lot of people have trouble with acne. Women, I've seen people have their voice drop with testosterone. So testosterone can be very helpful, but it carries pretty robust side effect profile. So if your big concern is, I want to have more muscle or I want to sleep better, women sleep better, men sleep better when we release growth hormones. Sermorelin also works. Sermorelin, very similar. It's a little quieter. So it is not as, I don't want to say like robust, but essentially it's just a little bit quieter in the way that it works than ipamorelin and tesamorelin as well. Tesamorelin is our only FDA approved fat loss, and it is FDA approved for muscle. It also helps with fat loss, so like visceral fat reduction, same as AOD. AOD is kind of a fat mobilizer, whereas tesamorelin is a fat burner, but they work together. Sometimes they're paired together. And then anything else that goes with growth hormone. AOD does not release growth hormone. So that's the difference here when you're looking at these. All the first ones, first one, two, three, four that I put there, those are going to work on growth hormone. AOD just works on fat, primarily visceral fat. So there's a lot of discussion about visceral fat, that fat that's around our organs and how bad that is for our health. So if you're interested in something that works with fat mobilization but don't want the growth hormones, then AOD might be what you want to consider. AOD is there on the end. I'll bring that up at the end, just the questions people always have with that one. Brain, mood, and sleep. I mentioned, I'm going to go back one. Here with sleep, women and men, I keep saying women a lot, so I know there's several gentlemen on here. You'll just have to forgive me. Um, Sleep disruption as we age is a huge issue. It's a huge issue in perimenopause. I think women probably experience it a little bit more than men, but men do certainly get restless sleep. There's a lot of talk about what happens when we have our hormones going, our cortisol going all the time. We call it adrenal fatigue. I don't really like some of the other names that we use for it, but essentially your body gets into this state of fight or flight. You don't sleep while you're tired and wired. And then you're not producing growth hormone, which is how you heal at night, and you're staying inflamed, you're not sleeping well, and it becomes this vicious cycle. So these can be very helpful for you, and they don't have the same side effect profile that we see with the pharmaceuticals that people use for sleep. Most women that go on these say they sleep really well. It's the first thing they notice. People that stay on that for it. Men really like the recovery in the gym. So they really feel stronger in the gym, not in a way like I just drank a bunch of caffeine, but just in a, oh my gosh, this is how workouts used to feel for me. So that's usually what men will say to me when they take those is like, oh, I just feel like I used to feel. And these are our brain function, brain and mood. CMAX, which is for brain fog, cognitive function, ADHD, post stroke. There's some studies behind post stroke there too, or traumatic brain injuries. So concussions is healing the way that the brain functions. And then Selink, which is for anxiety. Anxiety in a way that is not sedating. So I have several women that are on this and a few men that are on the blend as well. Selink and C-Max are commonly offered as a blend together. So you take just one. So think of it as focused without the jacked up feeling of caffeine. So you're taking it, you have clarity, but you're calm about your clarity, which is very different than a lot of the other things we offer people, the Adderall and things like that, which are giving people focus, but they're giving them in a way where they kind of feel all over the place and then they stay up. So a lot of times the medications that people are taking for focus keep them awake. So then they need something to help them sleep. When we take this blend together, we have more focus, but in a calm way. And then Delta Sleep Inducing Peptide, DSIP. This helps with deep sleep. So it's another one that helps with sleep. Sleep guides everything. So we have a lot of men, they have really high stress jobs. Their cortisol is really high. They cannot sleep. They're in this vicious cycle. And that's where we see something like this. They take it and then they sleep really well. Or women that hit perimenopause, especially the second 2 weeks of their cycle, they cannot sleep. They're up all night. They don't do well. Or shift workers, people who work overnights, and they can't flip back to that cycle. People use it there as well. And then we have longevity and hormones. These work on mitochondrial function, your telomeres, which are the end caps of your DNA, they wear away when you're aging, hormone signaling, and libido. MOTS-c, mitochondrial function, fantastic. People like this a lot. It really helps with your energy level and not your energy, again, like a caffeine, but just, oh, I don't feel like I'm dragging all day long. I don't
Mhm.
feel like I'm having so much trouble doing everything all day the way that I used to. A lot of times people are super burned out. They don't even realize how bad they feel. And then they take something like MOTS-c. People also see they have better exercise performance on it. It also is quieter than GLPs, but does work on fat loss and insulin resistance. So if you are not interested in taking a GLP, MOTS-c can be very helpful for you. It just takes a little bit longer, but it works a little bit quieter in the background, and then you get these other other benefits of it. So just like I said, the other ones kind of cross over. MOTS-c is going to cross over that way too. If maybe you don't have a an issue with appetite control or you don't need a lot of insulin help, but you do want some fat loss and energy, MOTS-c can be great for that. NAD. NAD is not a peptide, but we're putting it in here because it's in the same place. We use this for fatigue, brain fog, anti-aging. It helps your body repair and recover. It helps with detox. So we use this too in people who are burned out and they just feel like they don't get enough sleep to ever recover from it. NAD you need to be a little bit careful with because NAD can cause a little bit of racing heart. I've seen it in MOTS-c very, very rarely. More it's like an anxiety, but NAD absolutely can do it. I would caution you against taking your GLP and combined with in combination with NAD. There's one or two really special online pharmacies that are combining it, and I've seen people 100% end up in the ER because they get that racing heart in conjunction. So NAD with B vitamins and GLPs and dehydration can be a recipe for the ER. So if you're going to take NAD, you want to be taking that in a controlled way that you can take it by itself. Glutathione, master antioxidant. A lot of talk about glutathione. Your body helps, it helps your body heal. It helps your body drop heavy metals, drop mold, drop anything that it is building up. Free radicals, things like that that are showing up in the body. Glutathione is offered orally. You can take it sublingually or you can take it in an injection form. And epitalion, which works on the telomeres. Those are the ends of the DNA. People like this one for anti-aging. There's a lot of talk about longevity, how to help ourselves live longer and better. And epitalion is that way too. We do damage to our DNA over time from environmental toxins, from stress, from free radicals around in our body and our food, and just part of aging as our hormones change. And so epitalion can be helpful for healing that. It's usually cycled, and I don't know why I only wrote that on all of them because all of them are usually cycled, especially growth hormone support. You need to come off, but I recommend all my clients come off. They come off for just a little bit. It's called a receptor break. We take like a 4 to 6 week break in between. If you don't, you'll downregulate your natural production. So naturally, we produce all of these peptides, and if you take them all the time, your body stops producing what it needs and then it stops working because so say you're operating at 20% and we add peptides and then we're operating at 50%, the body's going to go, "Oh, I don't need to make that 20% anymore." And then you're going to start feeling 30% again or lower. So you do want to take a break, epithelion and growth hormones especially. And then kisspeptin, which is for low hormones. So people who are not interested in hormone therapy or coming off of birth control will sometimes go on kisspeptin. And people who are working to improve their fertility. So it just works on low hormones all across the board. And then PT141, which is libido, but it's libido in the way that it works in the brain. So it is also FDA approved for hypoactive sexual desire disorder, which is but essentially like loss of libido, where you're just not as interested, whether that's from stress or from hormone decline. PT141 can be very helpful in menopause and also men as they age. It is available in injection. It's also available in a nasal spray. It doesn't work immediately. It's like a 3 to 4 hour window of improvement there. So these two are good for people who are maybe not interested in hormone therapy yet, or they're wanting, they're younger, and so it's in a place where we're wanting to protect fertility. Hormone therapy can be very helpful, but especially for men, when we talk about testosterone decline, it's not a good idea to be taking that if you're wanting to maintain your fertility. So that's where you might want to look at something like a growth hormone and PT141 versus a testosterone so that you don't run into that issue with your fertility. Retatrutide. I cover this a lot in my GLP one. So if anybody wants the GLP, let me know and I'll send that to you. It's where I break down the three, so semaglutide, tirzepatide, and retatrutide. But I've had a lot of talk about retatrutide again, so I wanted to cover it. It's our newest GLP. It combines GLP, GIP, and glucagon together, all three. So GLP is Sermorelin. Semaglutide, when you add GIP, you have tirzepatide, and then when you add glucagon, you're getting retatrutide. It is the most potent fat loss one we have. The data is stronger. We also have seen about 50% improvement in joint pain in people who are on it. We saw similar improvement in people that take BPC 157, but Reta is unique in the way that it works. It's helping the body oxidize fat. So something important to know with that one is that if you're someone that exercises quite a lot and you go on tirzepatide, frequently people will have fatigue because they're not able to eat quite as much. On retatrutide, you can eat more carbs and still lose weight. So that makes it really great. There's also been some studies that have come out with rats and tumors, and they've shown a 70% reduction in tumors on Reta that persisted after they stopped. So the GLPs are pretty groundbreaking, and Reta is no different. It is in last stages of clinical trials. We have it pharmaceutical grade, Reta, from an FDA certified pharmacy. So if you are getting Reta right now, that is the biggest thing you want to look for. And I'll talk about that a little bit more because that's true with all the peptides. I've seen a lot of really great things with Reta. I've also seen a lot of people end up in the ER. Or I've seen people with really, really high doses and they say it doesn't do anything. And I'm like, I don't know what you were taking because it wasn't Reta. If you're taking, I've seen some crazy high doses and they didn't lose weight, and I'm thinking, I don't know what you're injecting, but it's not Reta. So you just want to make sure that you're getting it from a good source, which is true from all peptides. But we see it a lot with Reta. Reta is not actually new. It's been around in the bodybuilding universe for a very long time. A lot of people that you look at that are bikini competitors, things like that, they're using all these peptides. They always have been, and they've been using retatrutide. Um, I hope that really, I don't know that there's really a downside. Occasionally with retatrutide, I see a little bit of people getting an uptick in their resting heart rate. So if you're a person who tends towards anxiety really easy, or you tend towards that racy feeling, just be aware that it can do that and maybe talk with your provider. Or obviously, if I'm working with you, I'll let you know that ahead of time. That's just something that if you experience that, you might want to look at tirzepatide. The common misconception that I've seen quite a lot is that people think retatrutide is not a GLP. So I've had people come and ask me for retatrutide that did not realize it is a GLP. It just works differently. So I won't go into it too much because I did do an hour-and-a-half seminar on GLPs already. But when you think of the downsides of GLPs, think of Ozempic. Don't think of tirzepatide, don't think of retatrutide because the other two do a lot for inflammation. I watch women go on this that have struggled for years, not able to lose weight with inflammatory problems, and it drops. I've seen men go on retatrutide and increase their testosterone 100%. So to be able to increase your natural testosterone without taking synthetic injectable testosterone and not getting those side effects is pretty groundbreaking. I've seen men and women drop cholesterol, genetic cholesterol. So like they're eating all the right things, they're doing all the right things, they're exercising. We cannot drop their cholesterol and they go on these drugs, or I hate to actually, I should not even say drugs. They go on these peptides and it drops them in a way that we can't do with statins, or we do with statins and you get a lot of joint pain. So retatrutide really great for that, but so is tirzepatide too. The biggest mistake I see is that research grade is not pharmaceutical grade. This is the biggest problem across the board. Like if you take away nothing else from tonight, I hope that it's that. Research grade, the molecule itself is not bad. So I want you to think of it like food, right? If you're going to pharmaceutical grade, you're getting it from a restaurant. If you're going research grade, you're taking something that's not intended for human use. So it was not made for human use. It is not intended for human use. It is not in an FDA pharmacy. It is made in a lab somewhere. And that's like getting food from someone selling food on the street. Maybe it's fine. We could buy it, we could have our friends make us dinner and it turns out just fine. But we can also get food from someone selling it on the street and end up very sick. And so research grade is the same way. There's can be a lot of impurities in the research grade products because they do not need to maintain the same standard. If you are getting it powder and mixing it yourself, it's research grade. Research grade is also illegal right now in the United States. Not to have, it's illegal to sell. So there are still some companies that are selling it. The FDA is cracking down really hard on them because of the side effects we're seeing. Because people are ending up, they're a lot of times they're mixing it themselves, so they're getting the powder, reconstituting it themselves, and it's very easy to reconstitute at the wrong percentage, and then you're taking the wrong dosage which with something like NAD or one of the GLPs can be a recipe to go to the ER. It's not so much that it's a life-threatening trip to the ER. It's just a very, very uncomfortable, severe stomach problems or that super high racing heart feeling, which that in itself can be bad. It's also just that they're not intended for human use. So what is the cleanliness of the lab? What is the impurities in the products? Is there testing to make sure there's still efficacy, right? So is it still good after it gets to you? All compounded products are good for about 30 days. After that, the efficacy goes down, meaning they're less effective and they're more likely to grow bacteria. Everything I personally work with comes from a pharmacy, FDA certified pharmacy 503A, because I want to make sure that we're not giving anyone anything that has an issue. And the bigger problem or another problem with research grade is a lot of people have come to me recently that are looking for Retta, and I've had a few people come that had side effects. And I can't tell them if the side effect is from the Retta or the side effect is from something in the Retta, especially when I see people who took really high doses and maybe they felt racing heart and they felt a lot of anxiety, but they didn't lose weight. And the chances are then that they didn't take Retta, that they took something else, and we just don't really know what they took. So it's not so safe to do. There's a reason they're less expensive. Like I said, it might be fine if you know your pharmacy, but makes me a little uncomfortable. This is how I personally operate with peptides and how I think that people should operate. I look at symptoms first. So I always ask my clients, what are the three things you'd like me to change tomorrow? Because people come in and they see peptides and they see all the things they could do. And I know if you're anything like me, you have a lot of things that bother you, right? Maybe I don't sleep well, maybe my mood, maybe my focus, maybe my bloating, maybe I have a lot of things. But try to break it down and look at all the things that are happening, but in what order are they really affecting you? And then look at labs. We should look at labs from a functional standpoint, right? We don't want to be looking at pass fail. That's like telling a parent their kid is doing fine in math and they have a D minus. We want to look at what is going on with the labs. And then we want to include nutrition, strength, supplements. It makes or breaks the peptides. So a lot of times, I've had people say to me, well, peptides don't work. First thing I asked them was, did you mix it yourself? 90% of the time they say yes, and then we know why. Or they got it oral from there's a few multi-level marketing companies that are doing peptides orally. Sometimes they have good results, sometimes they don't. Um, So there, that's an issue, but we also want to look at nutrition along with it, supplements along with it. The efficacy of them is greatly increased. And there's also a few that can deplete nutrients, so maybe you need to take a zinc with it. Maybe you need to take a CoQ10 along with it so that you get the best results. And then we want to look at hormones too. Sometimes people they come in looking for hormone therapy, they end up on a peptide, or they come in thinking they want a peptide, they end up on hormone therapy. So that's something that maybe you're not getting when we go online. There's this whole influencer thing with peptides. Like you wouldn't get an antidepressant from an influencer shipped to your door. Peptides are no different. They are very powerful tools when they're used correctly, but the right peptide used on the wrong person is not going to do the right thing. We want to make sure that we're doing it. It's also where we want to use them in a stack. We want to maybe start with something that drops inflammation before we start asking the body to do something, right? So you don't want to come in with a growth hormone support and ask the body to do a lot when the body is already stressed out. It's not going to respond well to that. They're also not a forever protocol. We want to talk about what does your body look like when you stop? What happens at the end of a GLP? Maybe you're going to microdose for a long time, but if you go on a GLP and there's not a nutrition protocol with it, there's not a strength protocol with it, your chances of regaining the weight are really high, and statistically, you're actually more likely to gain back more. So you are statistically very likely to gain back all the weight you lost, but because you lost fat and not, or lost muscle and not fat, you're more likely to gain fat back. And so we're wanting to make sure that we are combining everything together so that when you come off of it, you cycle off or you go down in dose, you're in the best possible place. That's what I do. If you're interested more in talking about it, I do free 30-minute calls. I try to keep it to 30 minutes. I'm really bad about that. So I'm getting better at it as we're getting very full and I hate running over, but I'm not a salesperson. I don't really like pitching sales or forcing anyone into it. But if you just want to talk more about your specific situation and what might work for you or what you're doing, or you would like an opinion on, hey, do you think I'm a candidate for peptides or a candidate for hormone therapy? You can book. In the next 48 hours, you're going to also get a foundation stock PDF, and I'm going to waive everyone's telemedicine fee. So I have a telemedicine fee with my company that's $79. And so we're going to waive that for everyone that was on the call or watched it. Just helps you get a little bit more questions without that. And that brings us to questions and answers. I think I covered everything. I talked pretty quick, but I still think we covered. I tried to put everything in there. It always takes me so long to put everything together for you guys. So I'm going to open up the chat. And if you have questions, just either unmute and ask or drop them in the chat. No one has literacy. Why is it not still? I'm trying to find the chat. There we go. Yes, everyone that is here and registered gets a will get the recording. So if someone asks, hopefully you get the replay. Yeah. I know I talk fast. I always tell myself to slow down and ask and give people minutes to kind of comprehend everything. But I also know everyone's time is so precious. If you're anything like me, I got kids running around, I'm tired. So I don't want to keep people longer than we need to. So I did talk fast.
Oh, oh, cancel.
Oh yeah, here, I can give you the link for the call right now. Put that in. Sorry, I told myself to put that there too, but I'm just grabbing the link. If anyone has any other questions, feel free to unmute and ask. I will put the link for the call here. It's also going to be in the email. The Zoom recording. There. Is it safe to take GHK copper and BPC 157? So from our standpoint, I would just need a letter from your doctor saying that you are fully cleared, from cancer. So I know that's quite a struggle. So I guess congratulations, because I know that's a scary thing to go through. The biggest concern with the hormone, the GH hormone access ones that we talked. I don't know why I'm looking through the slideshow. I turned it off for you guys. Because there's the question of if it's growing something, and that is where I paused and said I would talk about it. So that's the quote side effect that we're seeing, where people talk about it, is they're saying if it grows something, if it's growing something in your body, it might be growing cancer. We don't have any studies that support that at all. That's a hypothesis. The hypothesis is if you encourage your body to grow, you encourage your body to grow more cancer. There are people saying, well, when we're younger, we produce more growth hormone and we don't have a higher rate of cancer. So just because there's more growth hormone doesn't mean that we're raising our rates of cancer. But there are people that have that concern. It's not as much of a concern with BPC and TB 500. I know every time there's something that circulates on Instagram, it blows up. I always get a lot of messages. We don't have studies supporting that. There are several guys, every Friday we do a big meeting with our whole medical team, and there are guys that have been using peptides for 10 years. Even when they were research grade, and just don't have any case studies of people having issues and side effects. So, and um, I have an oncology professional as one of my clients. So I wouldn't be concerned about that, but from clearance, because everything I do comes with one of the clinicians that I partner with, it is needing to get a clearance that you're cancer free. And it is more the thyroid cancers that are the concern, because we're working with the pituitary gland, KBV, thymosin alpha, and epithelium safe. Yeah, so it's just the growth hormone ones that you're wanting to be careful with. You're wanting to be careful with in terms of that, and your GLPs. There's a little bit of concern if you have a history of thyroid cancer specifically. But the other types of cancer, you should be okay. Whether or not your provider will say that, I don't know. There's not a lot of Western is like the best way to say it, but conventional medicine is not really on board with a lot of peptides quite yet. I've had some, but I was in the hospital with my mom a few weeks ago, and every single nurse was there. I was listening to them behind the curtain all talk about all the peptides they were on. So we do know that a lot of doctors and nurses are using it. There's just not a lot of doctors prescribing it, if you will, because of the way they work with insurance. So I don't know if they'll say, yes, you should try that. But we don't have any data saying that it's not safe. I just would be really careful where you're getting it. Should you do a certain panel of tests? Let me look. Sorry, I just got a message there. Um, It kind of depends on what you're looking for. We want a standard CBC CMP. So we want to look at kidney function. We want to look at liver function. We want to look at, are you anemic? Do you have any underlying infections? Before you start any peptide. That's really the biggest thing we're ruling out in terms of labs. Try to get a certain panel. We can also run labs. So if you come and you don't have labs, we can put labs in for you. It's no problem. We do it all the time. But if you're getting something from your regular provider or you're bringing something there, you want to have a CBC and a chem profile. Really great to have your cholesterol too if you're looking at a GLP, because usually we watch it drop. And so it's good to have that data. But from a clearance perspective or from a safety perspective, what we're looking for is your liver okay? Is your kidneys okay? Do you have any kind of anemia going on? Do you have any kind of infection going on in the background? Something that we need to worry about. And we can tell functionally how your gut is working by looking at, things like your BUN. We look for subclinical there. It's never a bad idea to have a thyroid function. I don't see a lot of thyroid issues in people above 40 that they didn't already know of. Usually people are having thyroid issues that they don't know. They're in their 30s. But occasionally, and so you might want to rule it out. If you're feeling fatigued, you want to make sure that there's not an easy answer. I'm also seeing a ton of vitamin D. I don't think I've had a client have a vitamin D that's normal like this year. It was a very cold winter. We all stayed inside. So, if your primary concern is fatigue, run your vitamin D. Not that you don't want to be on peptides, but if your vitamin D comes back at like 34, take vitamin D and see how you feel afterwards, or at the very least, take it along with it. Yeah, your oncologist knows nothing about it. It's really hard. One of my children has a really bad autoimmune disease, and I use her as my experience with a lot of Western medicine. They can be really great, but I had a lot of doctors tell me it wasn't autoimmune. I had an orthopedist scream in my face, actually, that it wasn't autoimmune. And then it was autoimmune and she could walk fine. So you just because they're not aware doesn't mean that it doesn't help, but you do want to make sure that obviously they're okay with where your health is. SS31 is another mitochondrial function peptide. Um, it just works a little bit different than MOTS-c and glutathione, and it is on its way to FDA approval, I believe, or at least there's enough clinical trials for it. Yes, it can be used in conjunction with reta. And the thing about getting FDA approval, there's not going to be FDA approval for a lot of these peptides because they can't patent them. So there are specific laws around patenting amino acid blends that are already present in the body. It existed because of insulin, because what they did was they came in and tried to make insulin essentially a name brand, charge a lot of money for it. So a lot of laws were passed. So a lot of these peptides they will not be able to name brand, and because they can't name brand it, they can't justify the expense of the clinical trials. So, or just, from a profit standpoint, right? If a company can't make millions of dollars or billions of dollars with the pharmaceuticals, if they can't make billions of dollars on it, they're not going to run tests on it. They're not going to try to get an FDA approval because that's a very expensive product. Peptides recommended for something with someone's with celiac disease. Yeah, the stack, the close stack. Great for autoimmune. I don't know why I'm sorry. If I keep looking over here, I'm not looking in space. I have another monitor and I keep going back through to show you the slide, which obviously you can't see. But any of the autoimmune for celiac, so people that have stuff like Crohn's disease or, if they have inflammatory bowel disease, that KPV can be really helpful. We do have KPV by itself. You can take KPV by itself if you want to start with just that, or start with KPV and BPC 157. Those ones that work on inflammation, that's what we're looking for there with celiac. You might also look at some of the more robust ones for autoimmune. But the inflammatory can be really helpful. And I've seen people with like psoriatic arthritis, psoriasis, very similar thread to celiac in the way that the body is processing. SLUPP332, I'm not familiar with. I'd have to look that one up. Does it have another name? Let me look it up. Let me see. Estrogen receptors. Oh, I heard a little bit of one of this one, making your body thinks like it's exercising, right? It's another exercise one. I don't have enough firsthand data about that one. We don't have it, I don't think. We didn't have it a month ago. We could have it now, but I'd have to look. If it's not tier one, we don't have it. So there's tier one and tier two peptides. Tier one are pharmaceutical grade. This one might not be. It's the same thing with melanotan. So if you've ever seen there's a peptide that can make you tan, you literally look like you're tan from taking it. It's not offered tier one FDA. So from an FDA pharmacy, so we don't have it. Let me look. Yeah, it's not through to tier one yet. So until it's through to tier one, we don't have it, which is probably why I haven't um I've heard about it vaguely, but it's not available. It's only research grade. Anyone else? I love good questions though. I'm gonna have to look that one up and see.
Are there any that you recommend injecting together and any that you don't recommend injecting together, like in the same syringe?
I wouldn't mix them unless they come pre-mixed.
Okay.
Yeah. And there's a few that need to go at different times. So anything that's a growth hormone needs to go at night
At
fasted.
night.
Yeah, if you take it, and that's a common thing is people will eat and take it and then they don't see a result because if you have insulin in your system, you're not going to release it. So you need to be 90 minutes fasted and then you want to take it before bed to be with that natural pulse.
Mm-hmm.
And then some of them you want to take in the morning. So that's a reason to not combine it. We have some that are combined in the same syringe. The reason to go with them with a stack that's already combined, not just from a price standpoint, right? If you get the four that are in Clo by themselves, it's 3.5 times more expensive.
Right.
But there are some that are going to rev your system up and some that are going to make you sleepy. But I think like we have MOTS-c in with tesamorelin. together in one injection. And when you get it from the pharmacy, that means that like we tested it 30 days out and made sure it was still that it was still effective.
Hmm.
So if you're going to combine it, I would do it that way. GLPs cannot be combined with any others.
No. Like
Yeah,
we were
that's the
told
way
we
to
could
do it.
do AOD and MOTS-C in the same
Yeah, we
syringe.
have it. We have it as a blend. So
Okay.
I'm sure that that means you can, but and I could pull up the ones that we have as a blend, and that would let me know more. Yeah, because you're probably doing the same thing that I'm doing, where it's like three different injections.
Yes.
Yeah.
I'm like, I'm running out of spots.
Yeah, this doesn't have the lists. I know I have it on my phone. Because I think we have Motzi in with Tessamorelin and with something else too. But it might be whatever you're talking about that's in with that one. AOD, Motzi, and Tessamorelin together. That's what I'm thinking of. I know there was another blend. PE, oh yeah, did you say PE 22? I was trying to look for what she said. No, PP 332. There's a few other ones we have in blends. CJC ipamorelin, very common in a blend. Tesamorelin, ipamorelin, common in a blend. You don't want to take ipamorelin, tesamorelin, and samorelin all together, but you could take
Right.
CJC and ipamorelin together. That gives you growth hormone release and growth hormone creation. So you create
Okay.
more and you release more. So that is common, that versus samorelin. There are some coaches that don't really say to do samorelin anymore because we have CJC IPA. So they just think it's a superior product. You're more likely to see the side effects in terms of flushing. So
Hmm.
people flush, their skin flushes, they get a little hot with it, with the CGC ipamorelin than the samorelin. So that's why I say it's a little bit more, quote, aggressive.
Hmm.
So some people will be on samorelin because quieter. Growth hormone, you definitely want to take a break. You want to do a 4 to 6 week receptor break in between rounds of it, just to give your body that natural production.
Right.
Marine. Let's see,
Well,
Tessa.
it's good to know that those ones can be mixed. It cuts down
So
on
you
one.
can get, oh yeah, yeah, those ones can be mixed. It also makes it less expensive, right? So you get Motzi and
Yeah.
Testosterone together, it's less expensive. CJC IPA together, it's less expensive. I haven't done the Motzi Tesamorelin seems like a really good, I don't want to say place for people to start, but for women, you're getting your fat loss, you're getting your insulin regulation, you're getting your, muscle comp. I tend to lean more towards CJC IPA than tesamorelin, but because you could get that in a blend, that makes that pretty attractive too.
Hmm.
Somebody asked Retta, Wolverine, CG. I mean, is that too many to take is kind of relative because you find people like I take a lot, but that's just me. Not a lot, but I find that once people like learn to optimize their body, they really like to take them. So there's not too many. There's kind of like what phase are we in, right? So energy goes down in the winter. So people tend to want more of the ones that help with energy in the winter. In the summer, people are wanting to be leaner. So then they're wanting to look at the ones that help with muscle and fat loss. And so there's a lot of cycling, which is very similar to what I do with clients with nutrition, right? We come up and down in what they're eating. We eat more in the winter, we eat less in the summer. When you're eating more in the winter, you're repairing hormones, you are repairing your skin, your joints, your bones. Things need calories. So it makes sense to do that in the winter. The same can be true of your peptides. You can have your healing peptides in the winter, be working on healing, and then you can lean on the other ones. You can get your Wolverine, and I'm guessing you mean GHK copper. You can get Wolverine and GHK copper together. So whoever's asking that question, I would get that one together if you can. Um, so that you're saving yourself, Motzi and tesamorelin. You're getting a lot of crossover on blood sugar regulation and fat burning because you have Reta, Mott, and tesamorelin there together. That being said, I do have somebody that's doing a similar blend. Tesamorelin's a little bit more aggressive than CJC IPA, so you might want to back down to one of the other growth hormones from tesamorelin just because of the fat loss perspective. Like I don't know this person asking question. I don't know what your body comp looks like, but that's a really aggressive fat burning profile to be on those three together. So you wouldn't want to take that as someone that's really lean. But if you're someone that's going to do a competition, I'm wondering if I think I might know who this person is. I have a few people that I've worked with that are competition level, right? So they're in bodybuilding competitions.
They're not competition level.
Um, there, when you're really trying to heal, you might be able to take that. Just make sure you really dial in your nutrition. So you're going to want to cycle on and off.
Mm,
So, Wolverine, JHK Copper together, I have a lot of trouble getting people off of that. They love it. They don't ever want to come off of it.
good stuff.
So what I'll sometimes do is move people from that to glutathione for a while and then move them back on. So they're still on something that is helping them with their inflammation. You could take those four together. I guess I don't know if I really answered that. You could. I would just make sure that you're working with someone that's watching your nutrition because you don't want to get hypoglycemic from not enough sugar or get your fats too low because it'll downregulate your hormones. So you just want to make sure that you're running labs every 3 months on that stack. Make sure you're protecting your hormones. Otherwise, you might need to be like drop reta while you're on those so that you're not too low or microdose. Does that make sense?
Are you able to hear me at all?
Yeah, I can.
Oh, geez. Okay, great. Yeah, my I'm 60 years old. I do jujitsu and then I work in construction. I want to lose about 40 pounds is where I'm at. So I just started the whole peptide thing. And so that's why I'm taking the Reta, the GHK,
Mhm.
and then the Wolverine. But I'm considering the Motzi and the testimonial because I heard that I'll lose a lot of weight that way. And I'm trying. I want to lose a lot. I'm I'm I want to lose about another 45 pounds. Is that too aggressive? Taking all of those?
It's on the fence of being too aggressive, yeah.
Okay. So
There are people that are going to argue that the tesamorelin is helping you maintain muscle while you're on the Retta, and the Motzi is working with your energy, and so it might work okay. I wouldn't do it for an extended period of time, but I think you could probably run it for 8 to 12 weeks and be all right. You might get the weight
what?
loss from Retta.
Yeah, because the Red I've been on it for I think this is my fifth week on it,
Hmm.
and total I've lost about 25 pounds already.
Yeah, that's fast. Don't lose weight faster than that.
I, I, I
You're gonna get at 5 pounds a week, you're gonna down the road a few months from now, you're gonna have really bad hair loss.
okay.
So you want to slow down on that a little bit. We usually tell people like 3 pounds a week is the most you want to see in weight loss because
Mm.
otherwise you also will lose muscle. So in that case, you might want to look at one of the other. Who are you working with? Are you working with a coach?
No, just actually my son-in-law owns the jujitsu gym that I started training at, and so he told me to get on the Reddit, and then a couple of guys in there, they look shredded.
Yeah.
They're on Reddit, and then everybody's telling me, oh, do the SS31. I don't know what the heck that is. So it's just like
Yeah,
people. I'm
they're
not
doing
working.
everything.
Yeah.
You might want to consider doing maybe like CJC IPA instead of tesamorelin. Tesamorelin, I'm on the fence. I'd have
Okay.
to think about it and look at your labs. It's not that it's not going to it's going to help you lose weight. It's just, are you going to lose muscle and are you going to lose your
Oh,
hair?
I didn't know
That's the concern is if you drop too fast. So we just want to make
that.
sure the tesamorelin is going to protect it. Maybe wait on Motzi and see how your energy is.
Oh,
If your
that's the top.
energy tanks, then do Motzi.
So
Um,
just do the CJC.
the CJC, but I don't know. You'd have to schedule. You could always schedule a call. We could talk about it more because I'm gonna hypothetical and go back and forth a lot in my brain
Okay.
and think.
Cool.
Okay. So I'll try to schedule a call.
Yeah, I just make sure you're working with someone or cycle it on and off because it is pretty aggressive. So you just want to be careful.
Okay. Where are you located at? Are you
I'm near DC, but I'm virtual.
oh, virtual. Okay, perfect. Yeah, because I'm in California right now.
Yeah,
Okay,
yeah,
perfect.
I do everything virtual.
Okay, perfect. Then I'll try to schedule a call. Do we once this is over, you're gonna send us something to schedule, or how does that
Yeah,
work?
yeah, I'll send you an email with it, or I put it in the chat too. If you want to save it, there I can put it there too again.
Okay.
And you can schedule that, and then we can look at more of your labs and what you're looking to be and where you are just to make sure, because they're also young guys, right? So what works for them,
Right,
want to
right.
make sure that we don't cause any issues down the road. But I get the theory of what they're thinking. You just got to work it through.
Yeah, I'm training with a bunch of young guys. Everybody's.
Oh, he went out.
Oh no, am I?
There you are.
Okay. Oh, sheesh. Okay, press the wrong button.
No, it's okay.
Okay, yeah, because I'm training with a bunch of young guys that I'm beating up, and they're beating me up, and it feels good. But I just want to I just want to I want to lose the weight, get shredded again, but I don't want to lose any muscle, of course.
Yeah, that's my concern there. If you're taking too many at the same time, the it might help with muscle, the tesamorelin, but if you're not really careful with that stock, you're gonna lose also muscle. 5 pounds in a month is a lot. You want to be careful.
Yeah, I mean, I'm not trying to gain muscle. I'm too old for that. I just don't want to lose it. That's all. I don't want to.
Yeah.
Yeah. Okay, great, great.
Is reta, glutathione, and mic with B12 safe to come take in a stack? Yeah, so you're not taking them at the same time, but you're on those three? I think the mic is also research grade.
Ooh,
Yeah, that's fine. Those are fine together. B12 is commonly so the big thing about reta, which is important for you too, is that so what's going to happen when the FDA approves reta is everybody's going to lose access to it for about a month. And when it comes back, it's going to be really, really expensive. Because right now, the Retta that is coming from the compounding pharmacies is exactly the same thing as what Eli Lilly is patenting. And as soon as it's patented, the pharmacies will no longer be able to sell it that way anymore. They'll have to put it in conjunction with something, just like tirzepatide. So that means right now we put tirzepatide most commonly with B vitamins. We carry it with B vitamins and with glycine, which is a precursor to glutathione. And that lets people get around the patents. So they'll do the same thing with Retta, but there's going to be a big run on it. Like I think our umbrella filled 20,000 Retta last week. So it people are already starting to get on it and stay on it. So if you are on it and you like it, make sure to stay with your provider because there's going to be a lot of month when they figure out that compounding that is going to make them take it off the market. And so it's probably going to be like mid to end of the summer. I don't know citizen meds. I don't know. Let me see. The big ones are kind of being. Oh, yes, I do. Yeah, safe is, I'd hate to use the word safe, but there is no contraindication with reta, glutathione, and that MIC-B12 combination. We don't have the MIC-B12 though. Well, I have a lot of people that have the MTHFR gene. We do genetic testing. I have quite a lot of people with that. So we tend to not do the B12 as much and we put them on methylated B. You just want to watch because you're on two that are burning fat. So just make sure that you're eating enough so that you don't drop muscle. Does anyone else have any questions? I will send out the recording and it should have the guide in it, which has kind of all of these again. I didn't break down the stacks, so you won't see like glow and clo listed in there, but I can put in the email what's in the combination of those and the Wolverine. And I don't know what they'll put Retta with, probably with B vitamins. So if you have an MTH, I'm hoping they'll also put it with glutathione. They did that with semaglutide, but I think that's it. Is that too many to take?
Question, if I can.
Mhm.
Um, my wife and I are taking the same. We're taking the copper, and we're taking Reta together. I'm the only one doing the Wolverine because I'm training. Is it okay? Because my daughter said that she's taking the BPC 157.
Mhm.
Is that good for my wife also?
Mhm.
It is. Okay.
Yeah, take it in combination. It'll save you a lot of money.
Okay, so I should get this. You guys on your on in your email, are you gonna have like a list of like a price list to buy the pharmaceutical grade from you also?
Yeah, I
Okay,
could put the price list in there, sure.
that would be awesome.
Yeah.
And then you have a and you guys have a a stack that with the Motzi and the CJ
We
CJ.
have Motzi with Tessamorelin stacked, so you could do that if that was what you wanted for a stack. That's one thing. And then, for example, so we could put you on Retta and then your Wolverine with GHK Copper together, and then Motzi Tessamorelin together. So you'd be on a stack, but it would be just 3 injections,
Oh man,
five,
yeah,
which is a lot less expensive.
yeah, that'd be awesome. Okay, okay,
And the GHK Copper by itself, it's blue, right? I'm just making sure
yes,
because yeah.
yeah,
Um, it can sting a little, so it does a little bit better with the Wolverine.
yeah. Our both of our stomachs are there's red marks and looks like bruising almost from taking it.
Yeah, from the copper. That's a histamine reaction. So you can actually take all natural antihistamines and it'll stop happening.
Oh, okay, okay, awesome.
Yeah, your body reacts to it, gets a little histamine reaction to the GHK copper.
Okay, okay. I had read someplace that they said I should get a longer needle, and that
To
was
put it in deeper, I guess, but you don't want to go in IM because if you go into your muscle, it's going to hurt like heck.
okay. Okay, yeah, no,
And some people will say dilute it. And the thing about diluting it out is if you dilute it out, you're having to get bacteriostatic water, and bacteriostatic water is illegal to sell in the United States right now. So what are you mixing it with? There's a lot of people who are bringing stuff in from China, mixing it with water that came over from another country and mixing it together in their kitchen and having issues. There's a lot of people doing well, but I wouldn't dilute it out because what we can give you is not something that is made in the United States or inspected. Does that make sense? So even though people ask me about diluting it, in theory, it should help, right?
Mhm.
And there are some really good sources, but there's also a few of them that are getting shut down. So mixing it with your Wolverine stack gives you that mix without us bringing in something that we don't know where it is.
Okay, 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 great. Yeah, then I'll look at the email and see if I can do some ordering from you
Okay, great.
because we've been doing the ones that we mix and that's what it says on there. They're for research only, and I don't want to do all of that if that's not a good viable source, you know.
Yeah, you can ask them. I mean, you can ask to see their third party testing. Sometimes they'll give that to you of it to make sure that it is what it is. But I've seen some people talking about, like 5 to 7% impurities, and some of the impurities that are in them are heavy metals. And does that, go up into your kidneys? And some talk about that too.
Okay.
Um, so the tier two research grade will probably come back to being legal, but right now the FDA is just trying to find a way to do it safely. So I personally just use the pharmaceutical grades because I figure if I'm injecting it, I want to make sure. And you want it to be like if you're paying less money is great, but if you're paying less money and what you're getting is less effective, it's
Right,
not
right.
like the Retta. If you're losing that weight, it sounds like you're getting actual Retta, but we want to make sure you're doing it and not giving yourself an issue.
Yeah, that makes sense. Yeah.
Yeah,
Thank you so much.
you're very welcome. Does anybody else have any questions? I think we covered everything. You're very welcome. I appreciate everyone coming. Perfect. Well, if no one has any other questions, I'm going to go ahead and wrap it up. If you think of anything, feel free to send me a message anytime. I'm happy to answer your message. You can send me an email. You can send me, don't send personal health information over social media, though. That's the only thing I want to say is don't send labs. I get that sometimes. It's not that it's bad. It's just that I like to keep it in one place. And
Mhm.
feel free to reach out, and then I'll send the link with the booking. And then information on waiving the telemedicine fee for everyone that came, and then you can rewatch if you have any other questions, rewatch it, or it'll be in the pamphlet.
Thank you.
Thank you very much. You're welcome. Have a good night.
Thank you.
Thanks, you too.
Bye bye.
Thanks.